Good morning, everybody. My name is Akriti Soni, and I'm a PGY1 internal medicine resident at St. Vincent Hospital, Worcester, Massachusetts. And today I'll be discussing with you a topic which, if dwelt further into, could avoid overtreatment, consequently reducing both adverse effects on patients and cost burden on a hospital. The study was conducted with the primary aim to distinguish between stroke mimics and true stroke patients based on clinical features and imaging. So, what is stroke? The World Health Organization defines stroke as rapidly developing clinical signs, a focal or global disturbance in cerebral function lasting more than 24 hours or leading to death with no apparent cause other than a vascular origin. There are multiple conditions that present with neurological deficits mimicking a stroke. The most common are seizures, conversion disorder, encephalopathy, brain tumors, and migraine. And because of the time-sensitive nature for therapy in strokes, it is not uncommon for a stroke to be overdiagnosed and then treated with tissue plasminogen activator or TPA therapy. So we at St. Vincent performed a retrospective case control study where we identified 116 patients who had received TPA therapy to treat stroke. Out of these, 79 patients who had a normal CTA or computed tomography angiography were included for further analysis. We further divided these 79 patients into two groups. Group 1 was cases, which were the stroke mimics, and Group 2 were the controls or true strokes, based on the MRI findings of the brain or the magnetic resonance imaging. We then reviewed their individual electronic medical records and included data regarding the past history of stroke, hypertension, diabetes, atrial fibrillation, hyperlipidemia, the National Institute of Health stroke scale, hemorrhagic conversion, seizure episode after TPA administration, etc. The data was then analyzed and the results were as follows. Out of the 79 patients with an initially normal CTA, 46 were stroke mimics on MRI. Table 1 shows the distribution of study subjects based on history. And the findings reveal that based on Fisher's exact and chi-square, there was a statistically significant difference in distribution of study subjects between the groups for prior stroke, history of seizures, depression, acute migraine episode, conversion disorder, and post-stroke recrudescence exacerbated by acute encephalopathy. The table 2 shows that there is no statistically significant difference between the groups with regards to age and NIHS score based on an independent t-test. And table 3 shows the diagnosis variables outcome in logistic regression. And it shows that patients presenting with acute migraine episodes and conversion disorder have a statistically significant positive association in being a stroke mimic. Although laboratory diagnosis and brain imaging can refine the diagnosis, clinical assessment remains vital because it is the first step in the diagnostic pathway and often directs the speed at which more complex procedures are undertaken. Multiple etiologies can mimic acute or subacute ischemic stroke, including seizures, membranous aura, venous thrombosis, strokes, depression, etc. Stroke mimics usually have less clearly defined neurological symptoms that typically do not adhere to well-defined stroke syndromes. The suddenness at onset is not always evident, and fluctuations in severity are common, along with systemic signs like drowsiness, confusion, agitation, or fever, which are often present. The treatment of stroke mimics depends on the underlying condition, and while it is not easy to confirm a stroke in the acuity of emergency room or medical floors, standard of care requires patient to undergo a CT stroke protocol before TP administration. Aura before onset, headaches, or a poor prior history of depression might point away from stroke when the CTA is normal. Based on our findings, it could be postulated that paying more attention to a patient's history and clinical examination as the first step can aid the accurate diagnosis of stroke mimics. Thank you.